This conference will now be recorded.
Bismillah ar-Rahman ar-Rahim. This is another link to our task today. So we'll start by Dr. Manikam. I will adjust the 10 minute now, okay?
Yes. Hello.
Start.
Hello, Mrs. Mary. I am Manikam, in charge of ST5 in charge of Gynae Clinic today. Shall I confirm your name? You are Mrs. Mary Jones now. You are 35 years. Is it?
Yes, Mary Jones, 35 years.
How can I call you, ma'am?
Mary,
You
fine.
you can call me Manikam. I
Okay,
have come to know from your details that you are positive for ROCA 1 and 2, and you have come here to regarding the removal of your tubes and ovaries to decrease the risk of ovarian carcinoma and breast cancer. Before that, shall I talk to you? Shall I collect some data from you so that it will be easy for both of us to discuss and come to a conclusion? And I will examine you in presence of the chaperone with your consent, and I'll give some patient leaflets also, and I'll discuss the things, and both of us will come to a conclusion, and I'll make an appointment with my consultant for you to come to a conclusion. Shall I proceed? Or am I clear, ma'am? Am I clear, Mary?
Okay, doctor, no problem. Can you adjust your connection, please, Dr. Manikam? Adjust your connection, because there is some interruption. Yes.
Is it now okay, sir?
Yes.
Can you tell me about any problem that you're having now at present?
Yes, doctor. Doctor, my mom has an ovarian cancer, and unfortunately, she tested positive for this cancer gene. I'm very worried, doctor. My specialist doctor advised me to do this screening test also, and I came positive. So I'm very worried to have this cancer. I'm very worried, doctor, and I wanted to have this surgery.
Anybody in your family being affected with this genetic condition? No.
Adjust your interruption.
Anybody in your family having this condition?
Yes, my mom has this cancer, and she did surgery. Yes, she did surgery and remove all things. Remove her womb, remove her tubes, ovaries, everything.
I'm sorry for her. How she is now? Is she okay now?
Yes, she is fine now, but I am very worried to have this problem also.
Is she doing all follow-up for the breast and all?
Yes, doctor.
Okay. Do you have any problem with your breast?
No, I didn't check my breast at all.
Please tell me about your menstrual history. Your periods are regular?
Yes, my period is regular and come every 28 days and last one since 1 week.
Do you follow any contraception, ma'am?
Yes, doctor, I use Marina.
You finished your family, is it? How
Yes,
many children you got? How many children you got?
Yes, I have two vaginal delivery and I complete my family, yes.
Okay. Yes, you're having Marina. It will be a good protection for your cancer of the womb also. There won't be any possibility of developing cancer of the womb. It will be protective in nature. That is a good thing you are having. And did you use any oral contraceptive, that is pill for your contraception before? No.
No, I didn't use oral contraception.
Did you have any medical history? Do you have any treatment with your GP?
No, at all, doctor.
Any surgery you have undergone?
No, at all.
Do you have any allergy?
No.
Do you mind me asking a few questions about your sexual behavior, nothing like that.
Okay, doctor, no problem.
Okay. So do you have any history of sexually transmitted infection?
No,
Do you smoke? Do you take alcohol?
no,
Any drug abuse?
no.
Are you aware of your blood group?
O positive.
Know your BMI, your body mass index?
Yes, 28.
Very good. And any other problem you have got? Are you well supported in your home?
Yes.
What do you do for your living?
Housewife.
You're happy with your family, no?
Yes.
Anything else you want to tell me?
Again?
Anything else you want to tell me?
No, at all, doctor. But doctor, I want to tell you that also my sister has breast cancer,
Okay,
and she did
sorry.
surgery for that.
Sorry. Did you do breastfeeding for your children?
Yes.
Thank you. Very good. That's a protective factor for you. And something I wanted to ask you. Any other thing you want to tell me?
No, doctor, at all.
Did your GP has taught you about self-examination of the breast?
No.
No. Okay. Doesn't matter. You can do that also. I'll teach you.
Okay.
Shall I proceed for the discussion? Do you have any other blood tests or anything with you? You don't have any other reading us, no?
No.
Okay. As you have completed your family, I'm going to tell you some few things. I want to summarize you finished your family at your 35 years, you don't have any illness, you don't have any surgeries also, you're positive for BRCA1 and 2, and your mother is being affected with the cancer ovary, your sister being affected with the CA breast. She's okay, no? She's okay,
She's
no?
okay. Yes, she is okay now.
Okay. So, it is better for you as you have completed your family at the age of for BRCA1, we advise after finishing the family to undergo the bilateral salpingo-oophorectomy. That means the removal of the tubes and ovaries through the small hole surgery. That is not a big surgery. And after that, if you are willing, you can undergo. This itself halves the risk of developing cancer breast. If you are wishing, there is another surgery called removal of both breasts. That also can be done. And for this surgery, you have to be in the hospital for some 2 to 3 days. Before that, you have to undergo some investigations. Anything else you want to ask me? Am I clear?
Yes, doctor, you are clear. So, any risk during this surgery? Any test to be done before this surgery?
Yeah. You have to do basic investigations like full blood count, then blood sugar. Like if you are not having that, but even then they'll be doing some investigations and X-ray chest will be undergoing.
Doctor, is there any risk to have ovarian cancer now?
One thing I have, sorry, I don't think that I am interrupting you. Did you have any cervical screening? I have forgotten to ask you.
Yes, my cervical screening program is up to date and normal. Doctor, any risk to have ovarian cancer now? I don't know.
The risk of ovarian cancer is more in the persons who are positive in BRCA1 and 2 positive people, and they develop the cancer at a younger age group, and but they have a better prognosis compared to the other people. But once you undergo the operation, there will be 98% protection from the cancer of the ovary. There is only 2% of development of cancer in the inner lining of the abdominal cavity. That we cannot prevent. This is a safe surgery, but some complications are there associated with laparoscopy or the keyhole surgery. There may be some chances of very rare chances of injury to the bladder or the water bag, that is the urinary bladder, or the tube conducting the urine from the kidney.
Time finished.
Thank you, sir. Sir,
Welcome, Dr.
I'm
Manikam.
not,
If you want,
this is my,
yes,
sir,
if you
this is
wanted
my,
to tell,
sir, this is my first attempt, sir.
no problem at
So please put up with me, sir. I should have done so many mistakes. I am
all.
going here and there. I am not well versed. Please put up with me, sir. And tell me about my performance, sir. I have to improve so much. I am only in the LKG now. Kindergarten
No,
baby, I am.
yes, yes, no problem at all. And I'm very happy to hear that this is the first time, and you don't afraid to share,
Yes.
and you get the ability to start. I wanted to tell you that some or most of the candidates will be shameful to do that. They will have shame to do that, to share in front of another colleagues and in front of another candidate. I was one of this candidate really. I in the start, I when I started to practice with my mentor, I was afraid and shameful. I sent him a message on the private to tell him, please don't ask me to share in the sessions. You can imagine, and this is very dangerous because if you will not share, if you can't share, if you are ashamed, it will affect your practice, your performance. You can't do that in the exam. Okay, you have to have self-confidence, trust in yourself. Okay, no problem at all to do mistake. The practice now, the aim of our practice now to do mistake, because this mistake will learn you, and you will avoid this mistake in the exam. So when I miss to ask the patient about open question in the exam, I will ask the patient open question. If I miss to ask the patient about the blood group, about her period, and I make mark about this point, I will write by my handwriting that I did that mistake, so I will not do this mistake again. So practice is very important, and trust in yourself. Okay, this to learn you how to have a self-confidence inside the exam. Okay, and this will give you a good impression, give the examiner a good impression about you. If you enter the exam in self-confidence, trust in yourself, this is an exam, an easy exam, more easier than part 2. I will do like what I do in my clinic. So this will raise your mark inshallah in part 3 exam. Part 3 exam is very easy, but as I told you, need certain skills and trust in yourself and practice with your study partner. Your performance was good for the first time. You touch a lot of the point of, important in this task really. You have some hesitancy with the communication with the patient. I don't want from you to be hesitated like that. Okay, and when they give or talk to the patient, please talk in small chunks and give the patient the opportunity to talk. Okay, this is consultation between you and the patient, so you have to give the patient opportunity to talk, and the patient or the role player will guide you during this consultation. Okay, so let her talk, let her guide you, listen to her carefully. She will give you some hints during the consultation. From the start, you greatly introduce yourself well and confirm the identity of the patient. This is very good. You check the purpose, but you didn't ask the patient. This is her purpose of the meeting. So you tell her that I understand that you are here today because you have 1, 2, 3, 4, and I wanted to examine you and ask you some question. At the end, I will give you patient. Not all of this. You have to check the purpose and stop. Give agenda and stop. Okay. So when you greet and introduce yourself and confirm the identity, the patient will talk. Yes, Mary. Hello, Mary. I understand that you are here today because you tested positive for the cancer gene and you request surgery. Am I right? Am I right? She will say, yes, doctor. Yes, doctor. Okay, so now you can put your agenda. Okay, Mary, I totally understand your concern, but before we'll discuss that, or before we discuss your concern, can I ask you some question to know more about you, and may examine you in the presence of chaperone? At the end, I will give you some patient information leaflet and the contact number. Is it okay? She will say, okay, doctor. So you have to confirm the identity of the patient first, check the purpose of the meeting second, and give the patient opportunity to talk, then put your agenda. Sometimes the consultation may be not clear in the start. Some candidate from the stress of the exam may stand in front of the cubicle reading the information, and they cannot understand what mean by this information. They cannot understand the purpose of the meeting today, what he will or she will talk inside the cubicle. This is from the stress of the exam. Okay, and even if the task is very easy for you and straightforward for you, from the stress and the examiner is inside and someone push you, and there will be ring, will be bell after 2 minutes, so you cannot understand what is the purpose of the meeting. So you can ask here, how can I be of help today? How can I help you today? After greeting and introducing yourself, hello, I am Dr. Ali, one of the senior doctor in the clinic today. May I confirm your name and age, please? She will say, yes, doctor. I am Mary Jones. Nice to meet you, Mary, or hello, Mary, like that. Okay. Then, how can I be of help today? How can I help you today? This is if the purpose of the meeting is not clear. If you can understand the purpose very well, so you can confirm this purpose. So I understand your notes is that you are here today because you tested positive for some cancer genes, and you are here requesting a surgery to decrease the risk to have a cancer. Am I right? She will say, yes, doctor. Okay, Mary. Mary, before we discuss the best management plan for you, can I ask you some question to know more about you? And let me examine you in the presence of chaperone, if you don't mind. And at the end, I will give you some patient information leaflet and give you contact number, arrange another meeting with my consultant. Is it okay? This is how to put agenda, okay? This introduction is very, very important, because if you talk well in this introduction, yes, please mute yourself all. This introduction is very important, because if you do well in this introduction, it will give you self-confidence. If you talk well in this first 1 minute in the exam, it will give you self-confidence and will give the examiner a good impression about you. Okay, but if you enter the cubicle hesitating, how can I confirm the identity? How I check the purpose of the meeting? Hesitated, wrong grammars, or can't talk English well, not fluent in English, hesitating in asking the question, this will affect you before affecting the impression in front of the examiner. This will affect your performance in the remaining of the whole 10 minutes. So please try to concentrate on this introduction, okay, to be fluent in this introduction. I will do 1, 2, 3. Okay, and this introduction shouldn't exceed 30 seconds or less than 1 minute. Okay, so this is how to introduce yourself and check the purpose of the meeting and put the agenda. And then come to the consultation. Okay, please, when they start the consultation, ask open question. Usually start by open question because they like this task, this type of the question very much. Okay, and this is also the first impression about you. This candidate ask open question, so give him give a chance to the role player to talk. Okay, so can you tell me why you did this test? Why? Like you did this very well, Dr. McKinnon. So she will tell you, yes, doctor, my mom has ovarian cancer and she tested positive for these genes, and also I advised to do that test, and unfortunately I came also positive, so I wanted to have this surgery. I'm very worried, doctor, to have this cancer. Here, your communication with the patient, okay, you have to show sympathy like you did, okay, but I wanted to feel from your tone of voice, not, it is not word we will say only word, no, your communication, your feeling. Okay, so you have to raise your communication in such sympathy. I'm so sorry to hear that. How she is right now. It changes the tone of your voice. Change the tone is very important. Don't be monotonous during the consultation. We are not keeping or only saying some information to the role player. No, this is communication. And as I told you, the one who can communicate good in part 3 exam, who is the one can pass part 3. Applied knowledge is important, but communication is very important. Sometimes you may have no applied knowledge about the task, and you still can pass if you did communication well with the patient. Okay, so I'm so sorry to hear that. And how she is right now. She said, yes, doctor, she is fine. So it changes the tone of your voice is very important. Okay, sorry. So have she offered any treatment for that? She will said, yes, doctor, she offered surgery. Okay, how she is right now? She is fine now, doctor. Here you have to ask the patient about any warning sign, any signs or symptoms of ovarian cancer. Okay, do you have any pain in your tummy? Any weight loss? Any loss of appetite? And this is to ask about any possibility of the cancer. Okay. Then you ask about the breast, and I told you that I don't do any breast examination at all. I didn't check my breast at all. You cannot pass this point. Okay, you have to put a stress in this point now, because if you leave it till the remaining or till the end of the consultation, you may forget it and you will lose a mark regarding this. So if the patient or if the role player raise certain concern, you have to put stress on this concern now, because of the stress of the exam you may forget. Okay, so Mary, you may examine your breast regularly and check for any lump, any discharge, any change in the contour, and if any of these, you have to seek a medical advice. Am I clear? She will say yes. Okay, doctor. Okay, this is how to ask about the history of the present illness. Usually our template is start by the history of the present illness. Okay, then come to the remaining history. You ask about the obstetric history. Very good, but I wanted to from you to ask by open question. Ask open question and one by one. Be organized. Have you ever been pregnant before? She will say, yes, doctor. I give pregnant 2 times and delivered the 2 times vaginal without any complication. Very good. The role player will tell you everything. Okay, so give her opportunity to talk. If the role player didn't mention any information, ask by closed question about this information. But we usually start by an open question. Have you ever been pregnant before? She will say, yes, doctor, 2 times. Okay, and did you complete your family? This is very important question, because you will offer the patient bilateral salpingioophthalmectomy, so the patient will not be able to pregnant anymore. So did you complete your family? She will say, yes, doctor, I already complete my family. Very good. Okay, then go to the remaining history, gynecological history. You ask about the period, but please ask open question. Could you tell me more about your period? The patient will tell you everything about the period. Yes, doctor, my period is regular and every 28 days, last one since 7 days. Very good. That's enough. Okay, do you use any contraception? She will say, yes, Dr. Marina. Cervical screening program is very important. You touch at this point at the end. No problem. No problem. At the end, in the start, in the middle, no problem. The most important that you touch. You will take the credit for this cervical screening program. This will be considered patient safety. So if you didn't mention at the whole consultation, you will lose a mark. If you mention it at the beginning, at the start, at the middle, you will take the credit. But from the stress also, you may forget if you put it in the hair in its usual site. Usually we ask the cervical screening program in the gynecological history. So put this after the period contraception. So I will ask about the cervical screening program, not to miss it. You ask about the sexual history, very good, and you signpost for yourself, no problem. This is very good. If you ask about the sexual history, you have to signpost for yourself. I'm so sorry if you find my question intruding. Do you have any problem with sexual intercourse? Like that, okay? Then you ask about the medical. Surgical history is very important here, and you cover this point because if the patient have multiple abdominal surgery, so the laparoscope, as you know, we will offer the patient a laparoscopic bilateral salpingio-oophorectomy, so the laparoscope may be not suitable for the patient, will put her at risk of the failed entry, intestinal injury, bowel injury, like that. So ask about the surgical history is very important in this task. Also medical history is important, because if we offer the patient hormonal replacement therapy, also after that, if the patient has a history of thrombophilia, clots will affect her management plan also. You ask about the smoking, alcohol, recreational drug, but you ask in multiple questions. Please don't do like that. Ask one by one. Do you smoke? She will say no. Do you drink alcohol? No. Do you use any recreational drug? She will say no. Okay, one by one. Okay. Okay, you cover this support at home. Very good. You may ask here about the psychological history, because this patient is worried and she has a horrible story. Her mother and her sister passed through difficult time. So you may also cover the psychological history. May be relevant here. Okay, so some women may find it is very difficult to cope with that. Do you feel that you want to talk with someone regarding this? I can refer you to expert person who can talk with you regarding this difficult time. She will say, okay, doctor, that will be very fine for you. That's nice, like that. Okay. Family history is very important. Please don't miss family history in like case. In such a case, don't please family history. You touch the family history. Okay, but if you touch the family history, please mute yourself. Dr. Sarah, mute yourself, please. Dr. Sarah, yes, okay. When you ask about the family history, if you specify for which we ask, it will be also very good. It will give a good impression in front of the examiner that this candidate is very organized. He know what is the important point he wanted to touch. So if you ask about family history of cancer in the womb, cancer in the breast, any clot like that, she will say, yes, doctor, my sister has also breast cancer. Again, sympathy. I'm so sorry to hear that. And how she is right now? She will say, fine, doctor, she did surgery, mastectomy, and she is fine now. And she is tested also for these genes. She will say, yes, doctor, she is tested and she is also positive for this cancer gene. I'm so sorry to hear that. Sympathy. Sympathy is very important. Non-verbal communication, your facial expression when you talk, when you say, I'm so sorry to hear that. Your facial expression, not only word we say. Communication is very important. Okay, do you want to add anything? This is very important question, because if we miss any information, we miss any point to ask the role player, we may prompt you to tell you about this point. Like this role player today, she prompt and she said, yes, doctor, my sister has cancer in breast and she did surgery, like that. Okay, then don't forget, please, examination. Examination will be also considered as a part of information gathering. Okay, so come to examine the patient in the presence of chaperone after taking the consent and the hand hygiene. So Mary, I want to examine you in the presence of chaperone, if you don't mind. This is how to take verbal consent of the patient. Okay, if you don't mind, this is how to take a verbal consent. So Mary, I want to examine you in the presence of chaperone, if you don't mind, after doing a hand hygiene. This is to check your pulse, blood pressure, temperature, to check that you are in best possible shape, and examine your tummy to see any pain, any mass in your tummy. Is it okay? She will say, okay, doctor. Okay, now come to the consultation. Okay, the aim of the consultation. This patient came today because she requested risk reducing surgery. So you can ask her about her background. What do you know about Mary? I'm so sorry. What do you know about about ovarian cancer? She may have some misunderstanding. She had misinformation. So you will collect this information. Okay, so you can ask this question to ask about patient about the background, or you may come directly to explain for her what mean by ovarian cancer, what is the risk of her to have ovarian cancer. Okay, Mary, having ovarian cancer may happen about 1 in 70 women at any point of the life, and this risk is increased if the patient has a family history, especially if this family member tested positive for this cancer gene, like our task today. As some of these genes may run in families called hereditary cancer syndrome. Am I clear so far? She would say, yes, doctor. Give small information and check understanding. Okay, as being a positive for this cancer gene, BRCA1 and BRCA2, this also increases the risk of the ovarian cancer to about 35 to 45%. So we recommend for that woman to have a surgery to decrease the risk to have an ovarian cancer, and that will be done by removing the tubes and the ovary. Am I clear? She will say, yes, doctor. Here you can draw for the patient. Here is your womb, here is the tubes, here is the ovaries. Okay, to reduce this risk, Mary, we'll remove this and you will point on the ovaries and these tubes. Drawing is very important in communication with the patient. Okay, so when you enter the cubicle, they will give you a notebook and they will give you one pencil. Okay, so this is to write some information in front of the cubicle, as we talked before in the introduction for part 3. When you stand in front of the cubicle and you read the instruction, you will write some information and what is the most important point you want to discuss with the patient. When you enter the cubicle, okay, and during the consultation, you can draw for the patient during by using these papers and this pencil. So drawing is very important. It will deliver the information very quickly to the patient. Okay, so you can draw. This is the womb. Here is the tubes, and here is the ovary. We will remove both tubes and both ovaries like that. Am I clear so far? She will say, yes, doctor. Okay. Then now come your applied knowledge about the risk-reducing surgery. Okay. We will do some screening test before this surgery. This is by some protein called the CA125 and vaginal ultrasound scan, and this to evaluate the presence of ovarian cancer. As Mary, some may have an ovarian cancer at the time of the surgery. This is the question the patient asked you. May I have ovarian cancer now, doctor? May I have ovarian cancer now and I don't know? You may respond to the patient or answer the patient by this. Mary, we will do some screening test before the surgery, and this is by CA125, certain protein which increase in half of the women who have ovarian cancer, and also a transvaginal ultrasound scan, and this to evaluate the presence of ovarian cancer. As unfortunately, at the time of the surgery, 4 in 100 may have this occult ovarian cancer. Am I clear so far? She would say, yes, doctor. At that time, Mary, at that time, we may need to do another surgery. We may need to do staging laparotomy. So you will be given, Mary, patient information leaflet and the consent to sign before this. Okay, as there is some risks which may happen during the surgery, like bowel injury, bladder injury, uteric injury, and the blood transfusion. Okay, this is regarding to the consent before the surgery. So the patient should be given patient information leaflet before the surgery, and also should be given a consent to sign before the surgery. Okay, discuss with the patient the risks that may happen, like bowel injury, bladder injury, ureteric injury, and the blood transfusion. And as we mentioned, sometimes we may find an cancer at the time of the surgery. At the time we may do another surgery at all, it will be staging laparotomy. Okay, this is the risk of occult ovarian cancer. Mary, this is type of the surgery can be done by keyhole surgery. Explain for her what is the keyhole surgery, where telescope containing camera will introduce through your tummy under general anesthesia to remove the both tubes and ovaries. This surgery will not eliminate your risk. It will only decrease the risk to about 96%, because sometimes the cancer may arise from the surrounding, and this is the residual cancer, about 4 in 100. You miss a very important point to discuss with the patient, the HRT. This patient is still at the age of the 35, so will remove her ovaries, the source of the hormones, the source of the estrogen hormone. So this patient will go in menopause, surgical menopause. So what you will do for this patient, okay, what you will offer for this patient, you have to discuss this point. You can't go outside the cubicle without discussing this point. Mary,
Yes.
after removal of the both ovaries, there will be a drop of the hormone secreted by these ovaries. And this hormone is very important to keep your bone strong and to prevent the menopausal symptoms like hot flashes, and also it keep your mental and sexual health. So you will be referred to the menopausal clinic to discuss with you the suitable hormonal replacement therapy. Am I clear so far? Yes. If the time allow you, the role player will ask you, doctor, how I can decrease my risk to have breast cancer? Also, my sister has breast cancer. I'm very worried about that, to have also this. Yes. And as you know, this patient is BRCA positive, BRCA1 and BRCA2, so she also at a risk to have breast cancer. So having this surgery by itself decreases the risk of having breast cancer. So bilateral salpingo-oophorectomy by itself decreasing the risk to have breast cancer. Also, she will be advised to follow the breast screening program. She may be offered non-hormonal option for the menopausal symptom. As you know, the HRT, which contain progesterone, will increase the risk to have breast cancer. The HRT, which contain progesterone. So this patient may be offered non-hormonal option at all. She may be offered the hysterectomy at the time of the surgery to give her estrogen only. As you know, the estrogen will not increase the risk of the breast cancer. The hormone which increases the risk of the breast cancer is the progesterone. So now I wanted to give this patient only estrogen. So what I can do, I will remove the womb to give her estrogen only. Because if I give her estrogen only and she still have uterus, she will have endometrial cancer after that, because the estrogen will be exposed to endometrial hyperplasia and endometrial cancer. So how can I decrease this? This patient at risk of having breast cancer. So I don't want to give her progesterone. So I wanted to give her estrogen only. So how I can give her estrogen only and she have uterus? So we can remove the uterus at the time of the surgery. So hysterectomy can be done and give only estrogen. Also, she may be given the HRT till the age of the 51, and she may be offered the prophylactic mastectomy and given after that a combined hormonal replacement therapy, no problem at all. She may be offered also prophylactic mastectomy, remove the breast to decrease her risk to have breast cancer. Take care also, her sister may need this surgery because there is a hereditary cancer syndrome, hereditary, so that her sister also at risk to have this when she complete her family. Okay. At the end, the communication is also very important here to give the patient patient information leaflet, to arrange another meeting with the consultant, give her contact number. Okay, if she has any query at all, to call you. This also will raise your communication with the patient. It's okay.
Yes, sir. Thank you very much, sir. Thank you very much for your chance.
Thank you for
Thank you,
you.
sir. Thank you, sir.
Okay, this is very important to talk about risk-reducing surgery to decrease the risk of the epithelial ovarian cancer. I took this information from this talk. This is the guidance of the management of the woman with increased risk of ovarian cancer, as mentioned there in the talk. In the talk, there is divides a woman to a woman has increased risk and woman with a high risk. The woman is with increased risk who have a positive family history, single member only affected, only one single member, and they are not having a cancer gene. This family member don't have the cancer gene, so it is negative to the BRCA1, BRCA2, and like that. So at that time, the risk of the woman who has this family history is 4 to 5%. what we can do for this patient, we can consider risk reducing surgery. Can consider. Okay. Okay. For the high risk woman, who is the high risk woman? The woman who have a family history suggestive of hereditary cancer syndrome. What does it mean? This means that she has a family history and this family member is positive for this cancer gene. So for example, her mother has a ovarian cancer and her mother tested positive for this cancer gene. So what we can do for this patient, we will offer reducing surgery. We will offer here the risk reducing surgery. They don't recommend at all screening. We don't recommend a screening at all. Only for the woman who refuse this risk reducing surgery. If the woman refuse this risk reducing surgery and she is one of the high risk, we may offer this woman screening. Okay, so here no evidence to support screening at all. We may offer a screening. We may offer screening to who decline the risk reducing surgery. Okay. The patient who have BRCA1, her lifetime risk is about 35 to 45%. So we'll offer here also bilateral salpingioophthalmectomy at the age of the 35, who will complete her family. The woman who have BRCA2, her risk is 13 to 23%, and also will offer here risk reducing surgery. But we may delay the surgery at this type of the woman who have BRCA2 till the age of the 45. Okay, because the onset of the cancer here will be delayed. So we can delay the surgery till the age of the 45. Take care, there is another also cancer gene called hereditary non-bulbous cancer colon, which increase the risk of the breast cancer, ovarian cancer, and womb cancer and colon cancer. So this patient will be also at risk to have a womb cancer or endometrial cancer. So we'll do bilateral salpingioophthalmectomy with hysterectomy. Okay. Okay, this is some information also from the same talk. When we offer the patient hysterectomy, when we will offer the patient hysterectomy also, in addition to the bilateral salpingioophthalmectomy. Very important information, you may be asked in the structured discussion. We will offer the hysterectomy if the patient has this one hereditary non-bulbous cancer colon, the one called the Lynch syndrome. Lynch syndrome or hereditary non-bulbous cancer colon. We'll offer the patient also hysterectomy because this patient will be also at risk to have endometrial cancer. Some women who have this BRCA1 or BRCA2 may need to take tamoxifen to decrease her risk as a chemoprophylaxis to prevent this breast cancer. So she may need to take tamoxifen to decrease the risk of the breast cancer. As you know, tamoxifen may increase the risk of endometrial cancer. So at the time, if the patient wanted to take tamoxifen, we may do also hysterectomy. Okay. Okay. If the patient want also to take estrogen only, the patient is afraid to have a breast cancer, so she doesn't want to take progesterone. She wanted to take estrogen only. So at the time, we may give her estrogen only, but before that, we will remove the uterus. So three situations, we will remove the uterus. If the patient has Lynch syndrome, hereditary non-bulbous cancer colon, if the patient wanted to take tamoxifen, if the patient wanted to take only estrogen as a hormonal replacement therapy. Okay. This some information about the preoperative evaluation, as we mentioned that this patient wanted to do CA125 and the transvaginal ultrasound because there is risk to have an occult cancer about 4 to 8%. Okay. The conclusion in this talk mentioned that they don't recommend at all screening for the ovarian cancer. If the patient has risk to ovarian cancer, so we'll offer risk reducing surgery immediately. Any questions so far?
Sir, the LNG IUS, that also protective, no, sir? That
Again?
Marine also would be protective, no, sir? For the cancer endometrium. Marina will be endometrial protection,
Marina.
sir? Yes, sir.
Marina?
Will be giving endometrial protection, no, sir?
Can be endometrial protection by Marina?
Yes, sir. That's what I mean. It can provide
yes.
endometrial. Yes, sir.
In which, yes, okay, Marina is good, no problem, but take care, Marina is also contain progesterone. Okay.
Yes,
and
sir. That's not good for
yes,
breast. Okay, sir. Thank you, sir.
Yes, so take care of that.
Okay, thank you.
Welcome. Okay, so again, I want, yes, I was talking.
Assalamu alaikum. This is Salma.
Alaikum assalam. Alaikum assalam.
Dr. Ali, can you see the previous slide, please? No, please.
The previous slide.
Yeah, it was before. Before.
Okay, we can go again.
No, before.
Okay, I want Dr. Samarin, are you here?
Not before.
Can you join us, Samarin? Samarin, Dr. Samarin, Dr. Samarin Siraj. Okay, Dr. Rawat, are you here?
Yes, sir.
Okay.
Last slide.
Okay, this is your task. I will arrange a 2-minute.
Okay, sir.
2 minutes started. Okay, I will adjust it a minute. Start.
Hello, I am Dr. Vijay Lakshmi, the doctor in the gynae clinic today. May I confirm your name and age, please?
Yes, I am Mary Adam, 23-year-old.
And how can I address you?
Very fine.
Okay, so Mary, I understand that you were having some pain in your tummy and you had some ultrasound and blood tests carried out, and you're here to discuss the results. Is it right?
Yes, doctor.
So Mary, is it okay if I ask you a few questions to know more about you, then examine you in presence of a chaperone? then we can discuss your results and your further management plan. Is it okay?
Okay, doctor.
So, Mary, could you tell me something more about your problem?
Yes, doctor, I have this pain since a couple of months, and I went to my GP. He examined me and offered me this scan and some blood test, and arranged another appointment with you today to know the result.
Okay, so for how long were you having this pain?
Yes, and this was since a couple of months.
And was there some aggravating factor or
No, no, doctor,
relieving
none
factor?
specific. No,
Okay. And do you have any problems in your bowel or waterworks?
no.
Okay. And could you tell me more about your menstrual cycle?
Yes, my period is regular, doctor, and last one since 1 week.
Okay. And if I can ask you some personal questions just to know more about you,
Okay,
is it okay?
okay.
Are you sexually active?
Yes,
And are you using some contraceptive?
yes, doctor, I use coil.
Okay. Mary, it is always also good that if you can use, you can ask your partner to use a condom because that will protect you against sexually shared infections. Okay.
Okay.
And Mary, have you ever been pregnant before?
Yes, doctor, I get pregnant once and I delivered the vagina without any complication at all.
Okay. And are you seeing your GP for any other illness?
No,
Any surgeries done on your tummy or down below?
no,
And any family history of significance? Any family history of blood clots?
no.
Um, are you? What do you do for a living, Mary?
I'm a housewife.
Okay. And how's support at home?
Yes, my partner support me.
That's good. And do you smoke? Do you smoke, Mary?
No, doctor.
Do you take alcohol?
No,
Do you take any drugs for recreation?
no.
And what is your height to weight ratio?
28.
28. And what is your blood group?
O positive.
Any reservations or blood transfusion?
No, doctor, at all.
Any allergies?
No, doctor.
So, Mary, is there
Doctor,
any other?
I'm very worried, doctor. Excuse me, doctor. I'm very worried about my test result. Can you tell me what is in the test result?
Yes, we'll get to it. Mary, just let me complete your information taking, if that is okay with you.
Okay.
Is there any other information you would like to add to what I have taken from you?
No, doctor.
Okay. So is it okay if I examine you in presence of a chaplain while my nurse takes your pulse and BP, Mary?
No problem, doctor. Okay.
Okay. So Mary, is there somebody with you today?
How are you, doctor? I came alone.
Mary, yes, Mary, I have a little concerning news regarding your results. Is it okay? Should I go ahead?
Yes, doctor, no problem. I can cope.
Okay. So, Mary, on your ultrasound examination, it is showing that there is a big bag of fluid in your ovaries that is around 16 centimeters. Okay.
What is this again, doctor? Bag?
And this is a fluid-filled bag in your
Yeah.
right ovary, which is around 16 centimeters, and this is a significant finding according to us.
Oh my God, it is cancer, doctor?
No, Mary, it is not cancer as of now, but we need to go investigate it further in this by doing an MRI and MRI scan to see for any other extensions of this problem. Okay.
And what about my test result, my blood test, doctor?
So one of the results called CA125, that is a chemical which is increased in certain ovarian tumors, and in other benign conditions also is slightly raised. But the good thing is the other markers are absolutely normal. Okay, Mary.
Okay, doctor. So this increase my risk to have cancer also?
So Mary, what we normally do is we calculate the risk of malignancy index by taking the values of CA125, the ultrasound findings, and your menopausal status. Okay, since you are premenopausal, so your risk is almost risk malignancy index is very low. It's almost zero. Okay, so we are not suspecting a cancer as of now, but because of the size of the cyst, it can undergo a torsion, that is, it can turn around on itself, or it can rupture suddenly, that is, it can burst out anytime, or there can be some hemorrhage, that is, the blood could come into the cyst, and this would cause an acute emergency at that time. So it is preferable that we operate on this ovarian cyst, and we also send it for examination to be sure that it is a benign, it is not cancer. Okay.
So you will remove my ovary, doctor?
No, Mary, we will just when we this surgery can be done in two ways. One, we can do it through a keyhole surgery, and the second is by opening up your tummy from the bikini line. Okay, so we are going to see first. We are going to when we go inside your tummy, we are going to first assess whether it looks like a benign cyst, or does it look like a cancer, and then accordingly we will just if it most likely it should be a benign cyst, and so we'll just be removing the cyst, and we will try to conserve the ovary as much as possible. All right, Mary.
Okay, doctor. I want this keyhole surgery because I know that I will go home quickly because I am in the university. So I want this keyhole surgery.
So, Mary, I will be getting in touch with my consultant, and we will discuss as to what would be the best route of surgery for you. And keyhole surgery would be preferred, like you also, because firstly it is your choice, and secondly also because it gives faster recovery and less hospital stay, and you can go home earlier and less pain. Okay, but it has its own pros and cons. So should I go ahead with explanation of the
Time finish.
okay,
Okay,
thank you,
doctor.
thank you, Mary.
Okay, doctor. Doctor, I want to ask you one question. Can I delay or can I postpone this surgery till I finish my academic year?
Mary, it is not recommended to postpone the surgery, because, like I told you, this acute emergency of the ovarian cyst turning around on itself, or it is bursting out, or or blood collecting in the ovarian cyst is quite a possibility. So, and if we do your surgery by keyhole surgery, then you will be discharged the very next day after the surgery if everything goes on fine. So it would be recommended that you go ahead with the surgery as soon as possible.
Okay, doctor. Do you want to tell
Okay,
me anything, doctor? Thank you. Thank you.
thank you, sir.
Thank you, Dr. Lakshmi, huh? Lakshmi?
Yes, Vijay Lakshmi.
Lakshmi. Okay, thank you very much, Dr. Lakshmi. You did good in this task. You touch a lot of a lot of relevant point in this task. Really, I'll give you now the feedback. First, your communication was in the start was good. Okay, I feel that you have self-confidence in yourself and trust. This is very good, really. Okay, just practice more and more, and repeat the task more and more. It will be very easy for you, and you will keep the information by your heart. This by repeating the task more and more. You greet and introduce yourself very good to the patient and confirm the identity. You check the purpose in a very nice way. Excellent, really. But you didn't check the background. Okay, if you have to interpret some investigation, if you have some investigation outside the cubicle and you come to explain for the patient this investigation, this test, so you have to ask the patient about her background about this investigation. Did she know anything about this investigation? Anyone told her about this investigation or no? To know from where you start. Maybe the GP called this patient. Maybe the GP after the test called the patient and informed her that she had a cyst and her CA125 is high and she has a suspicious of cancer, like that. Okay, so she may know about the test result. So this will change your consultation. This is really change from where you will start. Okay, sometimes in the tumor, instead of breaking bad news, it will not be at all breaking bad news because the patient already know that she has cancer. So how come to do breaking bad news and already the patient know that she has cancer? So if the patient don't know anything about the test result, okay, you come now to do if she has cancer, if she has something very dangerous, you can do breaking bad news. But if she already know, you will start by another point at all. So checking the background is very important. So check the purpose of the meeting, and after that I will check the background of the patient. Mary, do you know anything about your test? Anyone told you anything about your test? She will say, no, doctor. Okay, then put your agenda as you did. You put agenda in a very nice way. Come to the template, our information gathering. You ask open question. Very good. Could you tell me more about this pain? Yes, very good to ask about open question in the start. Okay, ask about any factor increases pain, any factor decreases pain. Very good. You ask about the pressure symptoms of this cyst. This cyst may do pressure symptoms in the bowel, in the bladder. Very good. You didn't ask about the malignancy. Okay, about the malignant symptom. Did you lose your weight? Did you lose your appetite? Okay, so please touch this point. This will be considered patient safety. Have you offered any treatment for that? Did you offer any treatment for this pain? Also, this will be considered as a part of information gathering. Okay. Then regarding again to the communication, you didn't draw for the patient. You didn't draw for the patient. If you draw, it will be very good. Okay, you come now to explain for her the test results, so you will draw for the patient. So draw, this is the tubes, this is the ovary. You have here a fluid filled cyst or fluid filled space called the cyst, like that. Okay, we will come now to explain for you how to explain that. So you didn't draw. You give the information in small chunks and you check understanding. This is very good. Okay, you negotiate with the patient. When the patient told you that I want to postpone, you negotiate with the patient and you tell her that not recommended because this will put her at risk to have emergency surgery. This is very good also in the communication with the patient. Giving the patient information leaflet at the end and the contact number also will be considered as a part of the communication with the patient. Coming to the information gathering, as I told you, you start by open question. You cover the pressure symptoms. You didn't cover the malignant symptoms, okay, malignant symptom and signs. The gynecological history, you ask about the period, open question about the period, but the patient didn't mention at all any pain, any pain during with period. This cyst may be an endometrioma. So if you ask about the dysmenorrhea, it will be very relevant. So do you have any pain with your period? So this patient may have an endometriosis, and this cyst may be endometrioma. So if you ask about the pain, will be relevant. Sexual history. You signpost for yourself in the sexual history is this is very important and very good from you. Then ask about the contraception. It was also a relevant point. Regarding to the safe sex or condom, if you say how do you protect yourself from catching sexual transmitted infection, this is a better way to stress on the safe sex. Mary, how do you protect? She may use condom and she may don't use at all. So how do you protect, Mary? How do you protect yourself to catch a sexual transmitted infection? If you wanted to ask about the, if you have to comment, if you wanted to comment on the safe sex. Then come to the obstetric history. As I told you before, ask open question. Have you ever been pregnant before? She will say yes, doctor, one time vagina. So please ask open question. Okay, one open question. Any difficulty to get pregnant? If you ask her about that point, okay, because she has an endometriosis also, and she may delay it to become pregnant. She has some infertility or like that. You cover the sexual history is very the surgical history is very good, because we will offer the patient surgery by the laparoscope. So if she has any surgical history, it will make the surgery very difficult. You ask about the family history is also very good, to explore whether the patient is at risk to have ovarian cancer or breast cancer or like that. Okay, so any family history of ovarian cancer, any history of breast cancer, like that. Then the patient push you to explain for her the test result. I come at one point, you ask me about the allergy and smoking, and I feel that the time is running from you. I feel that the time is running and you still didn't touch the consultation. So the role player will prompt you, will push you. So doctor, I wanted to know about my test result. I am very worried about that. Okay, you have two options. In that time, you have two options: either to come immediately to explain for her the test result, okay, or you wanted to go organized and you bought a template for yourself, or you bought system for yourself. You wanted to finish the history taking in the start. So Mary, I can see how worried you are, and in a moment I will explain for you the test result. But if you don't mind, I wanted to ask you some question or ask you more question to know more about you. She will say, okay, doctor, okay, no problem. So you can't miss this point at all. If the patient push you to explain the result, you can't go or pass this point at all. You have two options: either to come immediately to explain for her the test result, or to go as you put yourself a system for yourself. So you want to finish the history taking. So Mary, I can see how worried you are, and in a moment I will discuss this test result with you. But if you give me time to ask you some more questions to more about you, it's very important to me. She will say, okay, doctor, no problem. Then complete your sheet. Okay. When you come to explain for her the test result, you didn't confirm the identity. This is a big mistake in the patient safety. If you come to explain for the patient the test result, you have to confirm the identity. Mary, let me confirm your name and age, please. She will say, yes, doctor, I'm Mary. I am Mary Adam, 23-year-old, like that. Or you can say, this is Mary Adam, 23 years old, NHS number 11, like that. Okay. She said, yes, doctor, like that. Okay, so you have to confirm the identity before explaining the test result. What else? Yes, regarding to the consultation itself, your applied knowledge about the cyst in the premenopausal woman was relevant, was good, but no need to break bad news. I feel that at sometimes you come to do breaking bad news. This is not a tumor. This is not definitely tumor. So no need to break bad news. You come to explain for the patient. You can come to explain the patient the test immediately without breaking bad news. So come to draw the patient. Drawn, very important to draw. Draw, Mary. The scan show that you have a cyst or a sac in your ovary. I can draw this for you. This is your ovary. This is the womb. Here is the right ovary, and here is a fluid-filled space called cyst. And this cyst is unfortunately a little bit large, 16 cm. Am I clear so far? She will say yes, doctor. So drawing is very important. Okay, if you draw for the patient, it will deliver the information very quickly. She come to ask you, doctor, is it cancer, doctor? Is it cancer? You answer the question in a very good way. Okay, Mary, it is unlikely to be a cancer in your age group, but we wanted to confirm that by doing more tests like MRI and to remove the cyst and to be examined in the lab, the histopathology. Okay, so you answer this question in a nice way. Will you remove my ovaries, doctor, during the surgery? Also, you answer the question in a nice way, and we have an ideal answer for this one. Your ovary is unlikely to be removed. Your ovary is unlikely to be removed. We may remove your ovary in certain circumstances. For example, if the cyst is very large and completely replace the ovary, if the cyst is twisted and decrease the blood supply to your ovary, or if there is suspicion that the cyst may be cancer. Okay, doctor, I wanted to postpone the surgery till I finish my academic year. Can I? You also answer the question in a very nice way, because this cyst may go in emergency and we may need emergency surgery. Okay, so we may at that time we may remove the ovary instead of removing the cyst. Please, if the patient till the patient will have her time till the surgery, we'll arrange for her the surgery. So the warning sign. Don't forget to stress on the warning sign, Mary. Till the time of the surgery, if you have any severe pain, if you have vomiting, if you feel that you are unwell, to come immediately to the hospital. Okay, this is regarding to the your feedback. So we will go to the suggested model of answer for this task. First, we will greet and introduce yourself as Dr. Alakshmi did. Okay, hello, I am Dr. Ali, one of the senior doctors at the clinic today. May you confirm your name and age, please? She will say, yes, doctor. I am Mary, 23 years old. Hello, Mary. I understand from your note that you are here today to discuss the test, the result of the test that we requested for 1 week back for your abdominal pain. Am I right? She will say, yes, doctor. Check background. Do you know anything about the test result? She will say, no, doctor. Okay, before we'll discuss the test result, I wanted to ask you some questions to know more about you. And they may examine you in the presence of chaperone and give you patient information leaflet and the contact number at the end. Is it okay? This is how to build the agenda. Come to our template, our information gathering. History of the present illness. Usually we start by history of the present illness. Could you tell me more about this pain? She would say, yes, doctor, I have this pain since a couple of months and in my lower tummy, and my GP requested this test and arrange an appointment with you to know the test result. Okay, Mary. And do you have any problem in water work? Any problem in opening your bowel? This is pressure symptoms. Okay, then come to the malignancy symptom and sign. Any loss of weight, any loss of appetite? She will say, no, doctor. Have you offered any statement for that? She will say, no. Then come to the gynecological history. Could you tell me more about your period? This is an open question. She will tell you everything about her period. You wanted to ask specific about the dysmenorrhea. So any pain with your period? She will say, no, doctor. Okay, do you use any contraception? She will say, yes, doctor, I use coil. Okay, then if you want to ask about the sexual history, you have to signpost for yourself. Mary, I'm sorry if you find my question intruding. Are you with someone right now? She will say, yes, doctor, with my partner. Any problem during sexual intercourse? Any pain during sexual intercourse? This is to ask about the dyspareunia, because also endometriosis and the endometrioma may be associated with this dyspareunia. Have you ever been pregnant before? She will say, yes, doctor, one time and delivered the vagina. Any difficulty to get pregnant? She will say, no, doctor, at all. Okay. Then come to the medical history, the surgical history, the remaining history, drug smoking, social history, psychological history, you may ask. And family history is also important to exclude that the patient has a family history of ovarian and breast cancer. Do you want to add anything? Thank you for sharing this information with me today. Mary, I want to examine you now in the presence of chaperone, if you don't mind, and after doing hand hygiene, I will to assess your pulse, blood pressure, temperature to be sure that you are in the best possible shape, and examine your tummy for any pain, any mass. May examine you from down below to see any pain and any mass. Come now to explain for her the test result. Can I confirm your name and date of birth, please? You have to confirm the patient identity, okay? Can I confirm your name and the age and date of birth, please? She will say, yes, doctor, I am Mary, I am 23-year-old. Mary, the scan shows that you have fluid-filled space in your right ovary, and this space or this sac is a little bit large, 16 cm, and there is no any other abnormal feature. I can draw this for you. This is the womb, and here is the tube, and here is the ovary. Your right ovary here has this cyst. Am I clear so far? She will say, doctor, any drawing, anything, even if you can't draw at all, anything. Imagine that you draw for the patient anything, but this will raise your mark in the communication with the patient, especially if there is lay examiner. The lay examiner, it is an examiner come from the general public, okay, and he don't have any information, he don't have any knowledge about the ovarian cyst at all, but he show your he come to assess your communication with the patient. When he see or she see you that you draw for the patient, this doctor is very good doctor in the communication. This doctor is safe doctor. He know how to deliver the information to the role player, to the patient. Sorry, he know how to deliver the information to the patient, so he can pass in this task. Okay, so drawing is very important, really, in part 3 examination. Okay, Mary, also your doctor has requested some tests for you for certain tumor marker, which is a substance increase in certain types of the cancer. 3 of these substances are normal, but unfortunately there is one is high, called the CA125. It is about 250. Am I clear so far? She will say, what is doctor? What CA125? It is a cancer, doctor. This may increase in some non-sinister condition like fibroid or endometriosis, but also it can increase in some sinister condition like ovarian cancer. So doctor, is it cancer? Mary, until now we don't know, but cancer is very unlikely in your age group, and most of the cysts will be benign. But we wanted to do more tests to know about this cyst, okay? And we will remove this test to be examined in the lab. This is the histopathology, the definitive diagnosis. So your care will be under a group of doctors, which include, this is a multidisciplinary team. When you mention the multidisciplinary team, you have to mention who will be there in the multidisciplinary team. Your care will be under a group of doctors, which include the gynecologist, the gynecological cancer specialist, and specialized nurse. You will be offered some more tests to know more about this cyst, like MRI, and we will discuss the treatment option with you. But usually we will need surgery to remove this cyst. Usually you will need surgery to remove this cyst. We have 2 types of the surgery to remove this cyst, Mary, either by keyhole surgery or by open surgery. But because this cyst is a little bit large, so you will need an open surgery. The patient told you that I want a keyhole surgery. She prompted you to comment on that. She prompted you. Okay, take care. If the role player say something, you have to listen to her. Listen to the role player. Don't take this question lightly at all. She wanted to tell you, doctor, you have to stress on this point. This point is very important. Doctor, there is a credit about this point. I want you to take a credit for this point. The examiner will raise your applied knowledge or patient safety if you mention this point. This is hint from the role player. Doctor, I wanted to have this keyhole surgery. Doctor, can I? This what the patient wanted from you to comment that the keyhole surgery would be not suitable for her because the cyst is large. So Mary, mostly you will need this open surgery because this cyst is a little bit large. Okay, and this surgery will be done by a cut in your bikini line, and you will be under anesthesia. There are some risks from this surgery, like any surgery, like bowel injury, bladder injury, blood transfusion, and you will be given patient information leaflet and consent to sign before this, Mary. Am I clear so far? She will say, yes, doctor, you are clear. Doctor, will you remove my ovary during this operation? Mary, your ovaries are likely to be removed. However, there are some circumstances we may remove the ovary, like if the cyst is very large and completely replace the entire ovary, if the cyst twists the ovary and the blood supply is cut off, and rarely if there is suspicion that the cyst may be cancerous. At that time, we may remove the ovary and do another surgery at all. Am I clear so far? She will say, yes, doctor. Will it affect my ability to get pregnant, doctor? Again, Mira, I totally understand your concern, but this is unlikely because each woman has two ovaries. And even if we remove one ovary, the other ovary can release the egg. Okay, then the histopathology, Mary, the tissue removed will be examined in the lab, okay, and you will be given appointment to discuss the result of this test. Am I clear so far? Yes. Finally, the role player will ask you about postpone the surgery. Can I delay the surgery until I finish my academic year? This also will be considered patient safety. I understand your concern, but I don't recommend that because the cyst is large. At any time, this may get twisted around itself and cause considerable pain, which necessitate emergency surgery. At that time, we may remove the ovary instead of removing the cyst itself. She said, okay, doctor. Mary, till the time of the surgery, if you feel any pain, vomiting, feeling unwell, you have to come to the hospital immediately. Now I will give you some patient information leaflet and the contact number, and I will write back to your GP. Is it okay? She will say, okay, doctor, thank you, like that. Okay, this is some information from the patient information leaflet, and also it's written there in the patient with the cyst in the premenopausal woman. As you know, all of you know that if the simple cyst measure less than 5 cm in the premenopausal woman, so even no need to follow up this cyst because mostly it will be functional cyst and will disappear within 3 successive cycles. So if the cyst is less than 5 cm, no need to follow up this patient at all. If the cyst is simple and between 5 to 7 cm, we can do annual ultrasound scan. Because if the cyst is large, more than 7 cm, we may do another test like MRI to can visualize the whole cyst, because the whole cyst may be not seen by the entirely by the ultrasound scan, and also we may offer surgery for this patient. Any question? Okay, good. Dr. Salma, are you with us?
Hello, Dr. Ali. I'm Dr. Askia.
Yes.
Dr.
I
Askia,
have one
are you?
question.
Yes.
I'm fine, thank you.
Okay.
Doctor, why you did not consider this IOTA, International Ovarian Tumor Analysis?
And
Because
international ovarian tumor analysis? Yes.
yeah, because actually here cyst ultrasound description not given in detail. Just they mention 15 centimeters cyst. So can we go for this
Yes.
IOTA to see the benign or malignant? Because still CA125 is high. Because for a pre-menopausal woman less than 40, we can go for this scoring B roll or M roll. And after that, we can do this MRI and MDT.
Okay, this international ovarian tumor analysis can it will be done by the ultrasound, and the patient also did ultrasound scan.
Yeah, but actually it is not
But
clear here that because it is simple scan done. So we can mention this thing, or what you think?
I think the patient did already ultrasound scan, so we will do again ultrasound scan for her. I think it will be, from my opinion, not relevant, but you can mention, but go to advanced or more advanced or another test like MRI. It will be suitable as mentioned there in the green top guideline. If the cyst is large, more than 7 cm, so the patient can do this MRI, because the ultrasound scan can't see the entire cyst, because the cyst is large, can't see. the whole cyst.
No, it will
So
not be
we'll
done.
do
It will not be done transvaginal. Ultrasound will be done transabdominal. Because so what is the
yes.
indication of iota? When we will do? You
With
mean that patient did
the
already
international.
scan, but I mean this scan is different. Iota is different because it has very high sensitivity and specificity.
Okay, you can mention, yeah, if you wanted to mention
Mm.
that, no problem. You can mention this also, and the MRI scan. So you can mention this screening by the International Ovarian Tumor Analysis and also the MRI.
Okay. And one more thing, this CA1, this risk RMI, risk of malignancy index. Can we do for this premenopausal woman? Premenopausal, I know this is one score, but like if because still we don't know it is clearly written simple cyst. Because can we mention here about RMI or no need?
I think no need to mention. I think if the patient in the postmenopausal, it will be more reasonable to mention this
Mm,
risk of malignancy index.
okay. Okay, thank you very much.
Thank you very much, Dr. Yasin. Okay. Dr. Salma, are you with us?
Yes, Assalamu alaikum.
عليكم السلام ورحمة الله. Okay, this is your task, Dr. Salma. I will adjust 2 minutes.
Okay,
2 minutes started.
okay, thank you.
Okay, I will adjust 10 minutes.
Hello, I'm Dr. Salma, one of the doctor in post-operative ward today. May I check your name and age, please?
Daniel Wilson, 26 year.
What would you like me to call you?
Miss Wilson.
Miss Wilson, how are you after surgery?
Fine, doctor.
Is there any pain or any temperature you have that you want to share today?
No, doctor, I'm fine.
So, Dania, is it okay that I understand that you want to know about you have some concern.
Doctor, please don't call me Daniel. I said to you, Miss Wilson.
Miss Wilson, sorry. Okay. Miss Wilson, you have some concern today that you want to share?
Yes, doctor.
Mm-hmm. So is it okay before explaining your concern and management plan, if I'll ask you some relevant question, then in front of chaperone, with your consent, I may examine you, then at the end, I'll explain you your management plan, and if there is any need to retain information, I'll give you also. How does it sound?
Okay, doctor, I told your colleague before the operation that I wanted to have a sterilization. Why you don't offer sterilization for me?
Mm-hmm. I'm sorry for that. About your concern, but the doctor during operation you told, or just before?
Yes,
Just
but
before operation. Yeah.
yes, but this was my request.
Mm-hmm. Actually, you know that any emergency situation, like you know that at the time it is your pregnancy outside the womb. So in this case, any emergency situation, if you take decision, you know that for the sterilization, we don't recommend it, okay, because you may regret later on. So that's why, you know, maybe my doctor, that my colleague, she didn't agree with you. So it's better beforehand, before 2 weeks, to if you think that yeah you need sterilization, to will take consent from you beforehand, and you explain everything, then you can take decision in better situation. Am I clear,
Doctor,
Ms.
yes,
Wilson?
doctor, you are clear, doctor, but I will not think about pregnancy anymore.
Mm-hmm.
I struggle with my children at home.
Mm-hmm. Yeah. Yes, if you think about that, so it is better, you know, if you, you know, if you'll take 2 weeks before or beforehand to give you time to think about that. So any emergency situation, it is, we don't recommend. And I'm sorry that you are concerned about that. Okay, so we can help you, that there is a more option later on, you can go for it. If you want, I can explain you.
Okay, doctor.
Thank you. So can you tell me that more about that? Do you have any that your period is regular?
Yes, doctor, my period was regular.
Mm-hmm. And have you taken any contraception before that? Which one is suitable for you?
Doctor, also this I struggle with my partner to use a condom, and he doesn't like to use this condom at all. Sometimes
Mm-hmm.
he uses and sometimes no.
Mm-hmm. Okay, right. Yes, there is any other option also, but you know the condom is suitable for, you know, to prevent the sexual transmitted infection. Okay, but I'll explain you other option also in a minute. Okay, and
Okay.
yeah. So what about your cervical smear?
Yes, it's up to date and normal.
Mm-hmm. I can see that you had 3 children. So how they delivered? Is there any complication?
Not all. I have 3 vaginal deliveries and I have 2 termination also.
Mm-hmm. So how that this termination, is it medically or surgically
No, it was
managed?
for personal reason.
Mm-hmm. But is it done by medical treatment or
Yes,
surgical?
yes, I took some medicine and I expelled already the pregnancy.
Okay, good. Any complication?
No, at all.
Okay, good. Do you have any other medical disease that you are following to GP?
Yes, doctor, I have epilepsy and I took already levetiracetam and carbamazepine.
Mm-hmm. Okay, and so are you following your doctor? Is it control your
Yes,
epilepsy?
well
Yeah,
controlled. Yes.
yeah. So, and any surgery before?
No, doctor.
Any family history of any medical disease?
No,
Do you smoke?
no,
Drink alcohol?
no,
Mm-hmm. And do you have allergy to any medication?
no.
Do you know your height and weight ratio?
Yes, 26.
Mm-hmm. Thank you for sharing all information. Do you want to add anything?
No, doctor, thank you.
Mm-hmm. So now coming to your this management plan, do you have any that any idea about that other option, or I'll explain you all?
No, doctor, I don't have any idea at all.
Mm-hmm. Okay, do you have any preference?
Yes, I was prefer to have this sterilization to finish thinking about this contraception at all, and I never thought about pregnancy.
Mm-hmm. Okay. Do you want me to? There is a alternative option also that that which one is long-term contraception. If you want, I can explain you that there is a less failure rate also. Otherwise, I can explain you the sterilization.
Okay, doctor, no problem.
Mm-hmm. So actually, this sterilization, which one you want, that it is there is a uh, that I can draw for you. You can see this is your womb, okay? This is tube and this is your ovary, okay? So this tube, with keyhole surgery, the doctor will that either they will put the clip or the ligate the tube. Okay, am I clear?
Yes.
Yeah, so the the failure rate is less 1 in 200. Okay, the failure rate, and you'll do the anesthetist will see you beforehand to give you the proper anesthesia, and there is a the anesthetist risks and risks of the surgery that the keyhole surgery that increased risks of bowel, bladder, vessel injury, increased risks of blood transfusion if there is a heavy bleeding, and if it has happened, so we'll um, repaired by the expert. Okay,
Okay,
so
doctor.
and there is an alternate procedure like the less failure rate also, like the intrauterine device, that means the coil to put your womb. Okay, and it is failure rate is also 1 in that 500. Okay, but it is if somebody has infection, active infection, then we don't recommend. Okay, but you can use it up to 5 years. Okay, so this
Okay.
is, yeah. And another, there is another also procedure that is, which is the Pla implant. So that means to put in your arm. So this is failure rate is very low also, 1 in 2000 the failure rate.
Okay.
But as you don't like, but I can give you the information leaflet for all of this the contraception, and you can take your time and think about that and let us know, or you can if you like, I can just you can ask me and you can decide which one you like. So what do you
So I'm
think?
finished. Okay, doctor. I will think about that, doctor. No problem.
Okay, thank you. I'll give the patient information leaflet and I'll inform my consultant also. You can discuss with him. So if you have any question, you can ask me.
Okay, thank you.
Thank you.
Thank you, Dr. Salma. Thank you very
Yeah.
much. You did good in this task. You cover a lot of point which is relevant really, but you miss also a lot of points that is very important in this task. So from the start, your communication is good. Greet and introduce yourself in the start and confirm the identity and check the purpose of the meeting. The patient here, this angry patient, take care of this point, this angry patient, and she wanted to take you, she wanted to hesitate yourself. I feel that you are trust in yourself and you are self-confidence. And I'm angry now because you don't offer sterilization for me. So I wanted to shake your confidence. I wanted to shake your confidence and your trust in yourself. So I wanted to take you out of this. When I told you, doctor, don't tell me, don't ask me or by my name, Please mute yourself. I told you to mention Miss Wilson. Okay. The good thing is that you didn't you didn't your confidence didn't hesitated. Okay. So you was also trust in yourself. No problem at all. Sorry, I'm so sorry, Miss Wilson. Okay, and you come again to the consultation. This can happen in the exam. Take care. And the role player, some candidate may feel that why the role player do this with me? Why? I am not good. Why she did that with me? No, she is instructed to do that. She is instructed to try to shake the candidate confidence, try to shake his trust in herself. So she wanted to take you out of the consultation. So your performance was good. Okay, to come again to the consultation. What again? You didn't cover a lot of points really. When the patient ask you to why you wanted to offer you don't offer for me sterilization, why like that, you come to explain for her the rationale behind don't not offering her the sterilization, but you forget a lot of point in the information gathering. After finish the consultation of the patient, you give her the rationale why you didn't offer for her the sterilization. You have to come again from the start. You have to come again from the start. So from the start, what will be in the start? Recovery. So you have to ask the patient about her recovery. The patient is now in the ward just after surgery to have an ectopic pregnancy. To this considered the patient safety to ask about the recovery.
Sorry, doctor, I asked.
You ask about the recovery, pain.
Yeah, after operation, how are you, Mrs. Wilson? And is there any pain? And is there anything you want to share? That any complication? I asked.
Good, good, very good. If you ask about the recovery, okay, very good. Then come again to the history of the present illness. As you know, we usually start with our sheet with history of the present illness. So could you tell me what happened? Could you tell me what happened? Why you have this ectopic? What happened when you come to the hospital? Like that. To ask about the event. She will say, yes, doctor, this was unplanned pregnancy, and I feel some pain and bleeding, and I about to faint. When I came to the hospital, they said that I have an ectopic pregnancy and they offer surgery for me. I told them to do sterilization before the surgery, like that. So ask about the event, what happened, okay? Please mute yourself again. Very good. So don't forget to ask about the history of the present illness. You ask about the obstetric history. Very good. Could you tell me, have you ever been pregnant before that? Okay. You ask about when she told you that I have termination. You ask in details about the termination. Was it for personal reason? Any complication at all? Blood group is important because if she has a ectopic pregnancy and she is Rh negative, she may need an anti-D. Okay, so if you ask about the blood group also, it will be very good. So the thing I wanted to stress here, when the patient want from you to give for her the consultation, give for her the explanation, okay, you have to come now to explain for her, or you can say, Mary, I totally understand your concern, and in a moment I will address your concern. I will answer all your question. But if you don't mind, I wanted to ask you some question to know more about you in the start. Is it okay? She will say, okay, doctor. So you will again start by information gathering. Again, when the role player prompt you to give her explanation about the test result or about the consultation, you have two options: either to go directly to explain for her or to make excuse. And yes, I totally understand your concern, and in a moment I will explain this for you, but if you don't mind, I wanted to ask you some question to know more about you, and they come to go through your template, ask about the recovery, the history of the present illness, like that. Okay. Regarding again to the communication, Dr. Salma, your tone of voice, I want from you to change your tone of voice during the consultation. When the patient said, I am struggling with my children, I don't want to think about pregnancy anymore. Yes, I totally understand your concern. Your tone of voice below. I'm so sorry to hear that, like that. Okay. Also, when the patient said, I have epilepsy and I took some medication, I'm so sorry to hear that. Like, sympathy is very important, and non-verbal communication, your facial expression is also very important in this task. You draw for the patient, very good in the communication with the patient. You negotiate with the patient to check understanding, give information in small chunks. This was very good, really, in the patient communication. You give the patient information leaflet. It is also very good. Regarding to the information gathering, as I mentioned, you miss only the history of the present illness to ask about the event. Okay, what happened? Could you tell me what happened? Okay, you miss to ask about the blood group. If you ask about the blood group, also it will be very good. Regarding to the sexual history, okay, because this patient, okay, you ask about the contraception. You ask about you put stress on the condom. Yes, condom can protect you from catching sexual transmitted infection, but it is not reliable method of contraception, like that. Okay. Then the surgical history, you ask the social history, support at home, okay, and the drug, the smoking, family history, all the remaining history covered. So only 2 points try to focus: history of the present illness and blood group. Okay, regarding to the patient safety, you didn't miss a large point in the patient safety, except the implant. The implant will be not suitable for this patient. Okay, take care, because she take enzyme inducer, and as you know, 3 option only will be suitable for the patient take enzyme inducer. This patient take carbamazine, as mentioned here. Okay, the patient told you that I take levetiracetam and carbamazepine, so this is enzyme inducer, so the implant will be not suitable for her. Okay, so you have to cover this point, and the implant will not be suitable for the patient. Okay, when you explain for the hair the long-acting reversible contraception, the LARC, you didn't touch. I think you didn't touch the Dibobravira, the injection, because this patient also has a needle phobia, and she may tell you, doctor, no doctor, I don't want any needle injection, I have a needle phobia. So you have to explore this point also when to come to explain for here the LARC. As you know, the LARC is 4 options: the coil or the copper coil or the Melina, the implant, and Dibobravira. The implant will be not suitable at all. Okay, and the patient will have needle phobia, and so the Dibobravira will be not suitable for the patient. So the coil and the Marina, and you have to negotiate with the patient regarding the 2 options. Okay, so this is regarding to the patient safety. Your applied knowledge about the sterilization was good. Okay, you gave here some pros and some cons regarding the sterilization. Okay, but if you put also more stress on the cons of the sterilization, the side effect of the sterilization, like the failure rate, and if it failed, it may be at risk of ectopic pregnancy. The reversal of sterilization will be difficult, not guaranteed to be founded by the NHS, not protect the hair from sexual transmitted infection, like in other surgery. Okay, there is some risks during the surgery, like bowel injury, bladder injury, and like that. Regarding the rationale about why you will not offer the patient this sterilization, your rationale was very good. Your explanation was very good. Okay, because we don't recommend to do this sterilization in the emergency situation. or pregnancy stress times, like termination, like deliveries, like salpingectomy, because there is a higher risk of the regret. And also the patient is young woman. She is 26 years old. So if the sterilization done before the age of the 30s, there is a high rate of regret. Okay. Also, there will be should be a reasonable time to take the consent before the surgery. This is the rationale why we don't offer the sterilization for this patient. So this is the good point and the weak point in your performance, Dr. Salma. Thank you very much. So let's go to the suggested model of answer.
Thank you very much, Dr. Ali,
Thank
to
you.
give me opportunity.
Thank you. Hello, I'm Dr. Ali or Dr. Salma, one of the senior doctors in the clinic today. May you confirm your name and age, please? She will say, yes, doctor. I am, what is her name? Daniel Wilson. How would you like me to call you? She said, Miss Wilson, fine, doctor. Hello, Miss Wilson. I understand that you are here today, or you just have a surgery for ectopic pregnancy. Am I right? She will say, yes, doctor. I'm so sorry for that. How do you feel right now? Do you have any pain in your tummy? Any bleeding from down below? Did you start to walk? Did you open your bowel? Like that, okay? This is how to ask about the recovery. Ms. Wilson, any expectation or concern from our meeting today? Yes, she said, yes, doctor. Why you don't offer sterilization for me at the same time? I will never get pregnant anymore. I requested this before the surgery, like that, like that. Okay. Now here you come to give her, you may come to give her the rationale behind not offering her sterilization, or you can delay this till the end of the information gathering. Ms. Wilson, I totally understand your concern. In a moment, I will explain the rationale for not sterilizing you, but I wanted to ask you some questions to know more about you. Is it okay? Okay, and I feel this is better not to hesitate, or you may forget some point and you may miss some point. So I prefer this option to address her concern. Yes, I totally understand your concern. And I can see how angry you are. And in a moment, I will explain for you the rationale why not sterilizing you. But I want to ask you some questions to know more about you. Is it okay? She will say, okay, doctor. Okay. You may ask about the recovery. How do you feel right now? Do you have any pain in your tummy? Did you start to move around? Did you open your bowel? Change the tone of your voice. Okay. Could you tell me what happened? She will say, yes, doctor, this was unplanned. I surprised to know that I'm pregnant. I have been in my tummy and some bleeding, and I am about to faint. When I come to the hospital, they said that I have an ectopic and offer surgery for me. Okay. And I understand that you have 3 children. Could you tell me more about these pregnancies? She will say, yes, doctor, I have 3 vaginal deliveries and 2 termination. Any problem so far? She will say, no, doctor. Okay, was it personal? Were it for personal reason? Yes, doctor. Okay, what is your blood group? She will say O positive or like that. Okay, could you tell me more about your period? What about your cervical smear and contraception? Okay, because this unplanned pregnancy, so you have to put stress on the contraception. She said condom. Yes, condom is good to protect you from catching sexual transmitted infection, but you have to use a reliable method of contraception. Am I clear so far? She will say, yes, doctor. Are you following your GP for any medical problem? This patient already has epilepsy and she is on levetiracetam and the carbamazepine, which is enzyme inducer. So put this in your mind. Okay. Also, she may have a depression and on fluoxetine. How well controlled? When was the last consultation with your specialist doctor? This will be considered to patient safety. Okay. Any surgery? She will say, yes, doctor, may have this termination or don't have surgery at all, no problem. Are you with someone right now? Support at home. Yes, doctor. Is he supportive? Sometimes he may help in the home, doctor. Okay. Any allergies at all? Do you smoke? Do you drink alcohol? Any family history? Do you want me to tell me about? Okay. Do you want to add anything? Thank you for sharing this information with me today. Then you come to examine the patient in the presence of chaperone after consent and after hand hygiene. Examine her pulse, blood pressure, temperature. Examine her pain for any, examine her tummy for any pain, any distension. Then you come to explain for her condition. Mary, or Miss Wilson, you have a condition called ectopic pregnancy. Have you ever heard about that? Here, the role player will prompt you to go to the sterilization. Yes, doctor, I know, and they explained for me what is ectopic pregnancy. But I want to ask you why you couldn't offer me sterilization at the same time. I never want to get pregnant. I requested that before surgery. Yes, Miss Wilson, I totally understand. I can see how angry you are. But if you give me some time to explain this for you, Miss Wilson, sterilization is permanent method of contraception, so you shouldn't think about that unless you are sure 100% you don't want children anymore in the future. Am I clear so far? She said, yes, doctor. I don't want children in the future. Okay. Here you come to explain for her what is the pros and what is the cons of the sterilization. After sterilization, you will not need any contraception anymore, unless for 7 days, and your hormones will not be affected at all. Any patient wanted to have anything, you have to explain for her the good thing first, and after that, the bad thing. Okay, this is how to gain the patient in your side. When the patient, for example, come to ask about home birth, for example, she has a big fibroid, or she have previous cesarean section and she want to have home birth. You will not come immediately to explain for her the side effect or the complication that may happen. No, explain for her why she wanted to have home birth. Then the good thing in the home birth, yes, I totally understand, and I understand that home birth will be very good because you will be surrounded by a lot of people that you know, and you will deliver your baby in a calm place, and you will start breastfeeding immediately. But I am so sorry, or I am afraid it will be not suitable for you. Why? 1, 2, 3. So when you come to explain the patient something which will not be suitable for her, give her the good thing first. Then after that, explain the bad thing or the complication that may happen. Don't jump immediately to the complication. No, start by the good thing. Sterilization. After sterilization, you will not need any contraception anymore, unless only 7 days. Your hormone will be not affected, and your period also will be not affected. But here is the rationale. We don't recommend this sterilization at the time of the pregnancy stress, like termination, delivery, and salpingectomy. Also, you are a young woman, and there is high risk to regret if this surgery done under the age of 30. Am I clear so far? Also, this was an emergency situation, and you have to sign a consent before the surgery with reasonable time. Am I clear? She said, okay, doctor. Also, sterilization, Miss Wilson, has some side effects or some complication, like about 1 in 200 women, the tubes may rejoin again, and this put you at risk to have an ectopic pregnancy, which happen outside the womb, which is very risky. Also, reversal of sterilization will be always difficult and not guaranteed to be found by the NHS. Sterilization will not protect you from sexual transmitted infections, so you have to use condom. Okay. This, like in a surgery, there is some complication that may happen, like bowel injury, bladder injury, and the bleeding. Am I clear so far? She said, yes, doctor. Miss Wilson, we have a different method of contraception called the LARC, which give you a long-standing reversible contraception, and you can get pregnant once you stop it. Okay, you can use any one of them till the age of the 30, and we can discuss the sterilization again. If you don't mind, I can give you some information about them. She will say, okay, doctor, here you will explain for her the LARC, the coil, Dibobravira, and Marina. Take care, the implant will be not suitable for the patient. The coil, which is put in your womb and prevent the pregnancy by preventing the egg to be fertilized by the sperm. The failure rate is about 1 in 200, like sterilization. You can keep it for 5 to 10 years. But it may make your period heavier or longer than normal. Am I clear so far? Yes. We have another option called Dibobravira Injection that acts by preventing the ovary to produce the egg and also make the mucus plug of the neck of your womb thick, which prevents the ascending of the sperm. This failure rate about 4 in 1,000, and it can act for 13 weeks. But it may make your period irregular or stop. No, doctor, I don't want this injection at all. I have a needle phobia. Okay, So we have another option called Mirena, which is a coil contain hormone progesterone between your womb, and it acts by preventing the implantation of the fertilized egg in your womb. Its failure rate is 2 in 1,000 and can act for 5 years. Your period may become lighter or stop. Is it harmful, doctor, to not have a period anymore? No, at all. This side effect is reversible. Okay. Okay. She will say, okay, doctor, I wanted to have this time. Again, implant will not suitable for this patient. Also, you may explain for her vasectomy if the partner accepts that. So we have also another option called the vasectomy, which is safer and quicker, and the failure rate is much less, 1 in 2,000. Can be done in outpatient clinic in 15 minutes, where the tubes of your partner, which carry the sperm, will be closed or tied. Okay. She will think, okay, doctor, I will think about that. I will think about that. Give me time to discuss this with my partner, like that, like that, like that. Okay, don't forget to put stress on the ectopic pregnancy. She may need urine pregnancy test after 3 weeks. Okay. Any patient with a surgical management salpingectomy will offer urine pregnancy test after 3 weeks. And also, if she become pregnant again, she may need an ultrasound again at 6 to 8 weeks to confirm the location. Does it make any sense? She will say, yes, doctor. Okay, now I can arrange another appointment with your GB to have this Mirena, and I will arrange another appointment to discuss this again. Ms. Wilson, using the condom is very important to prevent you, or to protect you to have sexual transmitted infection. Okay, okay, thank you, like that. Okay, all your comments, yes, and the message, very good. All your information, very good. Dr. Jane, for example, said that sterilization not recommended in emergency situation, and also in the patient under the age of 30. Yes, high rate of the, or high chance to regret. Yes, very good. Dr. Asma said sterilization consent 2 weeks back. Okay, so reasonable time. Dr. Manikam Dibobravira and ICD best for her. No, but this patient has needle phobia. Okay, so all your message or your information are reasonable for this task, really. Okay, we'll stop here today. Thank you for all of you. The time ran quickly, really. I was arranged to have more tasks, but the time ran quickly. So inshallah, we'll arrange another time, another session to discuss more and more tasks. Thank you for all of you. If you have any question, if you have any query, please send in our group steps for MRCOG. I hope that you, inshallah, will pass the exam. Thank you.